Welcome to the 2018 SPM Refresher Expo. This is Station 1, which is our in-bed mobilization station. For the setup of the room, we have to have a hill-rom bed. We'll have to have a chair. We're going to use the Mobilizer chair or a gurney to facilitate a transfer. We want to have the hover mat, which has all three sizes, the 34-inch, the 39-inch, and the 50-inch that can be used for bariatric patients. We want to have a breeze as an example of another option for transfers and lifts. And then we have some laminated signs here. We'll have a stop sign that also has the mat and the scoot on the reverse. We have HRO summary sheet that has the concepts that we've all been taught in HRO. We have an ABCDE reference, which is a little an acronym about some mindfulness things to keep in mind with our mobilizations. And we also have a hover mat instruction laminated sheet, and then how to identify the size of the hover mats. So our objectives of this station are to provide a clinical mobility scenario to facilitate staff cross-monitoring and speaking up for safety amongst their team members. We want to see participants demonstrate scripting and education that they would provide to patients and families. We want to see the appropriate selection of equipment and supplies, and the demonstration of a safe lateral transfer, a safe scoot up in the bed, and a safe turning of a bariatric patient. So our first scenario, the scenario is, we have a bariatric patient that has failed their scoot assessment with a score of 5. So we would want our participants to demonstrate how they would move the patient up in bed. And the things we would want to assure that they are including and demonstrating is making sure the appropriate sized hover mat is selected for the patient. And it's recommended that for turning purposes, a 39-inch or a 50-inch hover mat is used in response to challenges identified when using the 34-inch mat for turning. We want to make sure that the hover mat is centered under the patient. We want to make sure the bed is in Trendelenburg. We want to make sure the bed is at the right height. And we want to make sure the right number of staff are available to assist. We want to see a countdown or hear a countdown that is verbally conducted so all staff are moving the patient at the same time. And for the bariatric patient, we want to see that 2 air supply devices are used to inflate the hover mat. Can we cut here? Part 2 of the scenario is how would you turn a bariatric patient in bed? And you want to assure the following steps are included: that the appropriate size hover mat is selected, and again it's 39 inches or 50 inches is recommended. The hover mat centered under the patient. Is the bed at the right height? Do you have the right number of staff available to assist? And then with the hover mat inflated with 2 air supplies and all the side rails elevated, one person will guide the hover mat in the direction you want the patient to turn towards, and the second person on the opposite side of the patient will push the inflated hover mat simultaneously under the patient towards the center of the bed. And we will demonstrate that now. We're going to raise the bed up at a height appropriate for us. Is that good, Jen?
Yep.
We'll inflate. Turn camera. So the third part of this scenario is how would you laterally transfer this bariatric patient from the bed to a Mobilizer or a gurney, and we're going to use the Mobilizer as an example. You will again want to make sure that the following steps are included: that the hover mat is centered under the patient. You want to make sure that the bed is a little bit higher than the Mobilizer or the gurney, so they're going a little downhill. So we will make some adjustments there. You want to make sure that you have the right number of staff available to assist, and that a verbal countdown is conducted so that all staff are moving at the same time. And again, we'll use 2 air supply devices to inflate the hover mat. Yeah, and then you can. All right, we're going. Is the bed too high? Do we need to adjust that?
No, look okay.
It's good?
Yeah.
Okay. And we're going to inflate both air supplies. So in Station 1, mobilizing patients in bed, we want to make sure that we're reinforcing that we are still reprocessing unsoiled hover mats. There's a receptacle in everyone's dirty utility room to put unsoiled hover mats. And per the wound team, we want to minimize the layers of sheets under the patients in order to prevent HAPUs or hospital-acquired pressure ulcers. So make sure that we don't have layers of sheets under the patients. So facilitators, thank you for your assistance, and please prompt staff to engage in actual SPM activities and to provide feedback to each other. This is what should be happening in real time. People should be speaking up for safety amongst each other.